My name is Twyla, and at 28, I started losing my sight. I told my mother. She said I needed more sleep. For 6 months, my stepfather called it anxiety. My mother called it hypochondria, and the specialist they finally allowed me to see was handed a carefully edited version of my history. One where I was a woman prone to catastrophizing, someone who had always needed more attention than she deserved. What I actually was a woman with a tumor sitting on her optic nerve. But that's not the part that still keeps me up at night. What keeps me up is why they hid it, what they were protecting, and how close I came to losing my sight forever before anyone listened. The morning it started, I was driving to work on Route 9 when the left lane began to smear. Not dramatically, no sudden blackout, no movie-style darkness rushing in. Just a soft blur at the outer edge of my vision, like someone had pressed a thumb against the inside of a windshield. I blinked, adjusted the mirror, told myself it was the angle of the early sun. By the time I reached the dental office where I worked, the smear had faded. I filed it under fatigue and kept moving. It came back 4 days later, then again the week after that. Always on the left side, always accompanied by a pressure behind my eye that I can only describe as a slow, steady insistence. Not sharp, not unbearable, just relentlessly there. A weight that had decided to live in my skull. I mentioned it at dinner on a Thursday. My stepfather was at the head of the table, cutting through a pork chop with methodical precision. My mother was refilling her water glass. I said quietly that something felt off with my vision, that it kept blurring on one side, that my eye felt pressured in a way that didn't feel right. My mother set the pitcher down. "You're staring at screens all day," she said. "Of course your eyes are tired." My stepfather didn't look up from his plate. "Drink more water. Dehydration does that." I kept going. Described the pressure, the persistence, the way it didn't match any tired eyes feeling I'd had before. My stepfather finally looked at me. "Twyla." His voice was measured, almost patient. "You said the same thing about your heart palpitations 2 years ago. Turned out to be nothing. Said the same about chest tightness last spring. Also nothing." He picked up his fork. "At some point, you have to consider that your body isn't falling apart. You're just anxious." My mother nodded slowly, the way she always did when he finished speaking. I didn't answer. I had learned, over 4 years of living in that house, that silence was faster than argument. The vision didn't improve. By the 3rd week, the blur had stretched, longer, wider, harder to blink away. There were mornings I'd cover my right eye in the bathroom mirror and find the left side of my face smudged into itself, like a wet painting someone had dragged a finger across. I started wearing sunglasses indoors at the office, telling coworkers it was a headache. My coworker Rilla, who ran the front desk and had worked at the practice for 11 years, watched me for 2 days before she pulled me aside near the storage room. "What's actually going on?" she asked. I told her the truth, the blur, the pressure, all of it. "Go to an eye doctor," she said, without hesitation. "Not tomorrow. Today if you can get a lunch appointment." I made the appointment myself, on my lunch break, using a provider I found through the insurance portal on my phone. My stepfather handled all of our insurance. He had always said it was because he'd been burned by billing errors in the past and preferred to keep control of the accounts. It had seemed reasonable enough. I hadn't questioned it. The optometrist spent 40 minutes examining my left eye and then sat back and said, very calmly, that she wanted me to see a neurologist. That the pressure pattern she was observing wasn't consistent with eye strain or tension headaches. That she was submitting a referral. I sat in my car in her parking lot for a long time afterward, watching other people walk in and out of the strip mall, carrying grocery bags, talking on their phones, moving through a version of the day that felt very far from mine. The referral letter arrived at the house 11 days later. I found the opened envelope on the kitchen counter. The paper inside was gone. When I asked my stepfather about it, he didn't deny opening it. He said he'd thrown it away. A neurologist. He said the word the way people say unnecessary. "Do you know what a specialist consult costs with our current deductible? We're talking $600–700 out of pocket. Minimum. For what? So they can tell you to reduce your screen time." I said the optometrist had specifically recommended it. That she'd been clear. He said optometrists referred to specialists the same way mechanics recommended parts, because it kept everyone in business. My mother was standing at the sink with her back to us. She said nothing. I started keeping a log on my phone. Date, time, duration, which eye, intensity of the pressure on a scale of 1 to 10. I don't know exactly why I started. Something in me understood, even then, that I was going to need evidence, that my own experience wasn't going to be enough. March 4th. Left eye blur, 7 minutes, pressure 610, March 9th. Both eyes briefly, pressure 810. Dropped an instrument at work. Rilla noticed, March 14th. Pressure woke me at 2 in the morning. Rilla had noticed more than I'd hoped. She came to my station that afternoon and leaned against the counter. "You need to see someone who can order imaging," she said. "A neurologist, not the eye doctor." "I'm working on it," I said. "Work faster," she said. I tried. I called a neurologist and explained the referral. The receptionist was friendly, and then called back 2 hours later to say that my insurance plan had flagged the referral as requiring prior authorization from the primary plan holder. The primary plan holder was listed as my stepfather. I hadn't known that was even a structure that existed. I hadn't known he was listed as the primary on a plan that was supposed to cover me. When I brought it up that evening, he said it was an administrative technicality, that he'd set up the plan that way for simplicity, that he would handle the prior authorization himself. He never submitted it. April came and I stopped waiting for him. I scraped together $300 from my own savings and made an appointment with a neurologist who offered a self-pay rate. His name was Dr. Navarro. Quiet, careful, the kind of doctor who took notes by hand and didn't rush a sentence. He listened to my full symptom history without interrupting. When I finished, he was still for a moment. Then he said he wanted to order an MRI, that the symptom pattern warranted it. He also said something I hadn't expected. "Before I order this," he said, "I want to make sure you have a safe situation at home." I looked at him. He didn't elaborate, just waited. "Why?" I asked. "Because the pattern you're describing, the referral intercepted, the prior auth never filed, the insurance controlled by someone else. I've seen it before. And the people who maintain those patterns don't always respond well to imaging results." I drove home that evening with a referral for an MRI and a cold, specific weight in my chest that had nothing to do with my eye. I never made it to the scan. My stepfather found the appointment card. I still don't know how. I'd kept it in my work bag, tucked inside a book I was reading. But he found it, and that evening he sat across from me at the kitchen table with both hands flat on the surface, his voice patient and controlled. He said he understood I was worried. That anxiety created symptoms that felt completely real. That he wasn't dismissing my experience. He was protecting me from an unnecessary and expensive medical spiral. Then he told me he'd called the imaging center and canceled the appointment. He had used my name, my date of birth. He had called in as me. I said very quietly that what he had done wasn't legal. He said he was protecting the family from costs that weren't necessary. My mother appeared in the kitchen doorway partway through this. I looked at her. She looked at the floor. "He's only trying to help," she said. I went to my room, sat on the edge of my bed, opened my phone and added to the log. April 17th. Appointment canceled by my stepfather without my knowledge or consent. Left eye pressure, 910. Ringing in left ear. Woke twice last night. And then, at the top of the notes page, in capital letters, I wrote 4 words. They don't want me to know. My aunt's birthday dinner happened 3 weeks later. A warm, crowded gathering at her house with folding tables and too many cousins and a grocery store cake decorated with yellow roses. I wore my hair down to hide the way I'd started tilting my head, compensating for what my left eye could no longer track. I smiled when spoken to. I passed the bread basket. I told my cousin's husband his new job sounded interesting. Midway through the main course, my mother's voice carried across the table. "You know Twyla's been convinced she's going blind." She said it with a light, almost fond laugh, the kind that softens the cruelty just enough to make it feel like warmth. Several heads turned. "We keep telling her she just needs to put the phone down at night." But you know how she is. My aunt made a sympathetic sound. Anxiety. It runs in the family, my stepfather offered, reaching for his wine glass. Her father's side. The table moved on to something else. I pressed my fork against the edge of my plate until the tines left marks in the ceramic. On the drive home, I sat in the back seat and looked out at the passing streetlights. My left eye turned each one into a smeared ring of orange. I counted them the whole way. 19 streetlights, 19 smears. I was not imagining this. The collapse happened at a grocery store on a Sunday morning, in early May. I'd gone alone. I still could, if I kept to familiar layouts, if I worked the aisles from the right where my functioning eye could lead me. I was reaching for something in the cereal section when the pressure behind my left eye hit a register I had never felt before. Not a 10 on my scale. Something above 10, white and flat and dimensionless, erasing sound for a moment before it erased everything else. I reached for the shelf, my hand met air. I came back to a cold floor and someone crouching beside me saying my name. A young store employee, her hands steady on my arm, her voice calm in that practiced way people get when they've been trained for emergencies. "Don't move," she said. "They're on the way." At the hospital, my mother and stepfather arrived 20 minutes after I did. I was in a curtained bay in the ER, hooked to a monitor, when I heard my stepfather's voice at the nurse's station. "She has a history of vasovagal episodes," he was saying. "It's stress-related. We've seen this before." Vasovagal episodes. He said it with the fluency of someone who had prepared it in advance. The attending physician who came to examine me was a woman named Dr. Castillo. I remembered what Dr. Navarro had told me. "Ask for a neurological consult if you ever end up in an ER," I asked. Dr. Castillo raised an eyebrow when I described the months of symptoms, the referrals that had gone nowhere, the blur that had been growing for half a year. My stepfather appeared at the curtain before she finished her notes. "She doesn't need imaging," he said, measured and certain. "We've been through this. She has anxiety." The optometrist over-referred. Dr. Castillo looked at him for a moment. Then she looked at me. "Do you want your family members present for this examination?" she asked. I said no. She pulled the curtain closed. In the quiet of that bay, with only the soft beeping of monitors and the muffled sounds of the ER around us, I told Dr. Castillo everything. The timeline, the optometrist's referral, the intercepted letter, the canceled MRI, the log on my phone, which I pulled up and handed to her directly. She read it. She read all of it. Then she said, "I'm ordering an MRI tonight, under my clinical authority, for progressive neurological compromise. Your family does not have the right to override my clinical judgment." She stepped out to place the order. I lay back against the hospital pillow and breathed. When they wheeled me into the imaging suite, I could hear my stepfather's voice thinning somewhere down the hall, the controlled fury in it that surfaced when things weren't going according to his plan. The machine was loud and cold, and the technician told me to stay completely still. I did. I counted my breaths against the clicking and thrumming of the scanner. 47 minutes later, Dr. Castillo came back with a rolling monitor. She turned the screen toward me. A grayscale image of the inside of my skull, clear and specific. Exactly what my stepfather had spent 6 months trying to prevent me from seeing. She pointed to a shadow, small, defined, positioned with terrible precision. "This is a meningioma," she said. "A tumor. It's growing on your optic nerve. Based on the compression pattern, it's been there somewhere between 8 and 14 months. She paused. "It's benign, we have time. But not unlimited time." I stared at the shape on the screen, this small gray fact that had been quietly dismantling my life from the inside, while everyone around me called it anxiety. "You weren't imagining anything," Dr. Castillo said. "You were right about all of it." I didn't cry, I just nodded, and then very quietly I said, "I know, I've known for a long time." The neurosurgeon confirmed that surgery was possible, that the tumor's position was operable, that the risk of not acting was significantly greater than the risk of the procedure itself. She scheduled it for 3 weeks out. My stepfather said he would need to speak with his insurance broker about coverage. That was when the real picture came into focus. Dr. Castillo's team had flagged the prior authorization issue during my hospitalization. A hospital patient advocate named Miss Tanaka had pulled the insurance records. What she found was this. 2 years earlier, my stepfather had quietly downgraded the family health plan from a comprehensive PPO to a stripped-down catastrophic plan, one with a $9,000 individual deductible and severe restrictions on specialist referrals. He had done this without telling my mother or me. He had kept the difference in monthly premiums, nearly $280 a month, for 26 months. Any MRI, any neurology consult, any significant specialist involvement would have automatically triggered an audit of the plan by his employer's benefits administrator. That audit would have revealed the unauthorized plan change. He had been hiding financial fraud inside my medical care. When I called Rilla from the hospital, she was quiet for a long moment. Then she said there was something she needed to tell me. 3 weeks earlier, my stepfather had called the dental office. He had spoken to the office manager and told her I was experiencing severe psychological difficulties. He had asked them, as a professional courtesy, not to encourage me to seek further medical care, not to take my health concerns too seriously at work. Rilla had been at the front desk. She had recorded the call. She sent it to me that night. Miss Tanaka helped me build what she called a documentation package. The insurance records showing the unauthorized plan downgrade, the recorded phone call to my office, the log from my phone, 74 entries across 6 months, the photograph I'd taken of the optometrist's referral letter before my stepfather removed it from the envelope, the email confirmation from the imaging center showing the cancellation had come from someone calling on my behalf at a time when I was documented as being at work. The attorney I met with 2 weeks before my surgery reviewed everything and said plainly, "This is insurance fraud, deliberate interference with medical care, and a strong case under dependent adult statutes." I said I was 28. She said I had been on his plan, in his household, financially dependent on the insurance he controlled. The statutes applied. My mother came to the hospital the night before surgery. She sat in the chair beside my bed and looked at her hands for a long time. She said she hadn't known about the insurance, that she'd known something was wrong but had trusted him. She said she was sorry. I told her I believed she hadn't known about the fraud. I also told her I knew she had heard me say something was wrong for 6 months and had chosen the easier interpretation every single time. She didn't argue with that. She stayed until the nurses asked her to leave. In the doorway, she stopped and turned back. "You were always right," she said. The surgery took 4 hours. When I woke, the light in the recovery room was very bright and Dr. Castillo was saying my name, and I tested my left eye by looking at the ceiling and finding it not fully clear, not the way it had been before any of this began, but there, present, functional. At my follow-up 6 weeks later, the neurosurgeon told me that vision recovery in cases like mine averaged around 75 to 80% of precompression function. I had landed at 82. Long-term prognosis was good. She said that early intervention consistently produced better outcomes, and then she stopped herself because we both understood that the intervention had not been early. It had been 6 months late. It had been delayed by someone who had used the architecture of care, insurance, household, financial dependence, to build a wall between me and the truth about my own body. "You advocated for yourself under extraordinary circumstances," she said. The formal complaint was filed the same week I moved into my own apartment, a studio on the 2nd floor of a building 3 miles from work, with east-facing windows that caught the morning light and turned the whole room gold by 8 a.m. A second-hand dresser, a mattress on a frame, a kitchen with enough counter space for a coffee maker, and nothing else. The first space that had ever been entirely mine. My stepfather's employer opened an audit of the benefits account within 30 days. The audit confirmed the unauthorized plan change and the diverted premium payments. He was placed on administrative leave. His attorney described the situation as a regrettable misunderstanding about plan administration. The investigating office used different words. My mother filed for legal separation 4 months after my surgery. She made the decision herself, in her own time. She called on a Wednesday evening and we talked for almost an hour. Longer than we'd talked in years, maybe ever. In the spring, I published an open letter. I didn't name anyone in it. I just described what it felt like to have a body that was telling the truth while everyone around you called it a lie. I described the 74 entries in my phone log. I described the way I had started documenting, not because I was certain I was right, but because I was afraid that if didn't, there would be nothing left of who I had been before they rewrote me. It was shared more widely than I expected. The messages I received were from people in their 20s and their 50s and their 70s. People who had been dismissed. People who had dismissed someone and were only now understanding what that had cost. A retired nurse who had lost partial vision after a delayed diagnosis. A man whose teenage daughter had been told for 8 months that her pain was attention-seeking until it wasn't. A woman who had been keeping a log on her phone for 3 years and had never shown it to anyone because she thought it made her look obsessive. I read every message. I couldn't respond to all of them, but I read every one. This past spring, I stood at my kitchen counter making coffee while morning light came through the east window and lit the left side of the room. I looked at the wall across from me, with both eyes. The left one softer than the right, the outer edge of my vision still slightly smeared in a way that will probably always be there. A watermark left by the months of pressure, the months of waiting, the months of being told my own body was wrong. I had gotten used to it, not the damage, to looking anyway. There is a particular cruelty in being gaslit about your own health. It isn't just that the people you love don't believe you. It's that they know your voice better than anyone, and they use that knowledge against you. They know exactly which words will sound like concern. They know when to look tired of you, when to sigh, when to mention the last time you were wrong, until the line between your symptoms and your anxiety collapses entirely inside your own mind. I had almost let that happen. There were weeks in the middle of all of it when I woke up, wondering if they were right, if the blur was just stress, if the pressure was something I was manufacturing, if I was simply a person who needed more attention than she deserved. And then I would open the log, 74 entries, and I would remember what was true. If you have been told your pain is a performance, hear this clearly: it is not. Document everything. Take the photograph of the paper before it disappears. Save the voicemail. Write down the date, the time, the name of who was in the room. Not because truth needs protecting from itself, but because the people invested in erasing it are counting on you to do nothing. They were counting on me to do nothing. They miscalculated. And I am still here, looking at the morning light coming through my own window, seeing it with both eyes. Proof that I was right about every single thing I ever told them.